Hi everyone, it's Dr. Hall, and I'm going to do anterior thoracic wall with you today. And there are some blood vessels that are important, so we're going to start with some basics of blood vessels and then add to where we need to be for today. So I started off with an ascending aorta, aortic arch, and descending aorta. Now in real life it would be a little bit more like this, but I'm a little bit challenged with 3 dimensions in this medium a little bit today. So you'll remember the first branch off of our ascending aorta, aortic arch is the brachiocephalic artery on the right. Remember, this is the patient's right side, which is then going to bifurcate into the right common carotid and the right subclavian artery. I'm going to move that a little bit more proximal. Okay, so brachiocephalic artery, right common carotid, right subclavian. Then we have the left common carotid coming directly off the aortic arch and the left subclavian artery coming off the aortic arch. Remember A, B, C, S, right? So aorta, brachiocephalic, common carotid on the left, subclavian on the left. So now we're going to add the blood vessels that are pertinent to our study today, which are the internal thoracic arteries. And they come off of the subclavian arteries and travel inferiorly, and they're going to travel deep to the anterior thoracic wall. So we've learned a lot of arteries that have the word thoracic in them. So these are the internal thoracics. You might remember out when we got to the axillary artery, we had the superior thoracic, and the thoracoacromial, and then the lateral thoracic artery. So obviously these arteries are all in the thorax, hence the name, but it can get a bit confusing. So now we're going to add in our veins, which are anterior to the arteries. We have the right subclavian vein, right internal jugular vein. Once those two come together, this is now the right brachiocephalic vein. And on the left, out here, we are the subclavian vein, and then once the internal jugular vein drains its blood from the head, now it is the brachiocephalic vein, and they come together, of course, to form the superior vena cava. So we have veins that are traveling along with our internal thoracic arteries, which are fortunately named the internal thoracic veins. So we will add those as well. So let's take a look now at how this actually relates to our anterior thoracic wall. So here we have the sternum and its parts. So up here, the most superior aspect is the manubrium. There's a little notch here called the suprasternal or jugular notch. You can kind of feel that on your own self, that little hollow where that is. The clavicle articulates here, and then we would have the first rib. And you can see that medially, it's not bone. Medially, we have the costal cartilage, right? That cartilage gives a little bit of spring and flexibility to our rib cage before we get to the bone. And then where the second costal cartilage of the second rib is attaching, we have the sternal angle. So the manubrium is like this, and then the body of the sternum is at a slightly different angle. So there's the sternal angle right there, the body of the sternum, and then down at the bottom, we have the xiphoid process. We then go on to have ribs 1 through 7 all articulate directly, or their costal cartilages articulate directly with the sternum and are the true ribs. And then ribs 8 and 9 and 10 are false ribs because they kind of glom on to the costal cartilage of the other ribs, and 11 and 12 are floating ribs. I don't know how to fast forward the video, and it would take a long time to put those all on, so I'm not going to do that piece for you in the video. I will let you do that on your own time. So quick review, we have the body of the sternum, xiphoid process, manubrium, sternal angle, and jugular or suprasternal notch. Here's our clavicle, first rib with its costal cartilage, and second rib. Then we have our subclavian veins, which combine with the blood from the internal jugular veins to form the brachiocephalic veins in the superior vena cava, and the internal thoracic veins are draining blood into these subclavian veins. Artery-wise, we have our internal thoracic arteries here, which are draining into these subclavian arteries. And you can see that the left subclavian drains immediately into, or comes directly off of, the aortic arch, whereas the right subclavian, came off of the brachiocephalic trunk. So now I'm going to move on from blood vessels to show you the intercostal space. So intercostal means between the ribs, right? So I'm just kind of showing two respective ribs here. Here is my costal cartilage, so this is going to be the medial aspect of this space, and out here would be lateral. So the deepest structure we're going to find in the intercostal space is the innermost intercostal muscle. Now the innermost intercostal muscle is going to be the deepest, and its fiber direction is going to go like this. Okay, so it's going to go from superomedial to inferolateral. That's the fiber direction of the internal intercostal. Now I'm going to tell you, in all the diagrams, it shows that this muscle is easily visible, but when we're actually this far anterior and medial in the rib cage in the anterior thoracic wall, most of this muscle has just gone down to being a membrane. So it's actually pretty hard to see in the anterior thoracic wall. It's much easier to see in the posterior thoracic wall because it does continue around in that intercostal space all the way posteriorly. But one thing that's really important is in between the layer where you find the innermost intercostal and the next muscle, you are going to find the trio of an intercostal nerve, artery, and vein. And they're going to be located in the superior aspect of this intercostal space. That is clinically important because sometimes we actually need to take a needle and go in between somebody's ribs to sample fluid from around their lungs. So if we do that, we want to make sure we don't go in up here because it's going to hurt more and it's going to bleed more. Instead, we're going to go just over the top of a rib so that we stay in the inferior part of this space and are less likely to run into that nerve, artery, and vein. Now, the intercostal artery and vein that we have here are coming off of and draining into that internal thoracic artery and vein that we learned about earlier, which is going to be traveling deep. Let me bring this over to the ribs, running right along the inside here. Let me get my vein. Okay. The nerve, however, is coming from the spinal cord. So the nerve is actually coming from all the way around the posterior aspect of the body. So in our intercostal space, so far we have our innermost intercostal muscle, and then moving superficially, we find our intercostal nerve, artery, and vein. And then next, we're going to find our internal intercostal muscle. So here's our internal intercostal muscle, and it has the same fiber direction as the innermost. Okay, from superomedial to inferolateral. And this does extend all the way medially to the sternum. So my sternum is too small from my previous demonstration, but I'll put it in place here for reference. Finally, we're going to get to our external intercostal muscle. Now the external intercostal muscle, kind of like the innermost intercostal muscle, does not come all the way medially. So it's going to end about here, and its fiber direction is perpendicular to the fiber direction of the other muscles. Right? So I always remember external intercostal is like you're putting your hands in your pockets, right? This way. So going from superolateral to inferomedial. So that's going to be the fiber direction there. Because it doesn't extend all the way medially, we have a membrane. I made it a little bit too big. So this muscle turns into a membrane called the external intercostal membrane. And for that reason, when you're looking at the intercostal space medially, you see the fiber direction of the internal intercostal muscle through that membrane. You have to follow out more laterally to actually see those external intercostal muscles. So let's quickly review. We have the external intercostal muscle and the external intercostal membrane. Deep to that, we have the internal intercostal with its fiber direction going perpendicular to the external. Deep to that, we are going to find the innermost intercostal muscle, and in between these two muscles, the intercostal nerve and the anterior intercostal artery and anterior intercostal vein, which come off of and drain into the internal thoracic artery and vein. And that's it.